Hello, my name is Ashley Lowry. I'm an Indiana State University nursing student, and the title of my presentation is Ethical Dilemmas in Rural Communities. So who is at risk? The population at risk are individuals living in rural communities. Here are the following learning objectives for the presentation. At the conclusion of this activity, participants will be able to define ethics. At the conclusion of this activity, participants will be able to identify ethical dilemmas in rural communities. At the conclusion of this activity, participants will be able to identify why it is essential to uphold a code of ethics. At the conclusion of this activity, participants will be able to identify the need for a rural healthcare ethics agenda. I've included a pretest to check your knowledge on the topic. Don't worry, everything will be covered in the presentation and answers will be provided at the end. What is ethics? Ethics is a system of moral principles and values that affect how people make decisions or judgments. It involves systematizing, defending, and recommending concepts of what is right and wrong. Ethical codes exist to assist individuals throughout various businesses, organizations, and professions. And ethics can vary depending on values and culture. What may be right or true to one may not be right or true to another. On the left, we have the process for making an ethical decision. And on the right, we have the process for ethics and compliance risk management. When you're making an ethical decision, it's important that you stop and think. Next, you clarify your goals, determine the facts, develop options, consider the consequences, and then you must choose, monitor, and modify the choices that you made. In the ethics and compliance risk management process, you evaluate, define, prevent, detect, and respond. So what are ethical dilemmas? An ethical dilemma is a situation in which a difficult choice has to be made between two courses of action, either of which involves transgressing a moral principle. So finally, we get to the ethical dilemmas in rural communities. Confidentiality, so this entails overlapping relationships between healthcare professionals, patients, families, and members of the community. That can make privacy difficult. Truth-telling, choosing between healthcare ethics and going against community values. Some cultures disagree with the physician or healthcare provider stating that something is wrong or they are ill. Shared decision making, the struggle of deciding whether to disclose a medical option that isn't available or one that is often refused by rural patients. Another shared decision making ethical dilemma is when patients insist that the healthcare professional make the treatment decision for them. Boundary issues in professional patient relationship. The provider can have multiple roles when you're in a rural community, and this causes ethical conflicts related to boundaries. And disengagement of the provider may result in a sense of rejection, a lack of trust, and that would result in an unproductive clinical environment. Cultural and personal values. Influence is greater in rural communities because of customs that affect a larger proportion of patients versus in urban environments. Conflict arises with insufficient recognition or respect for indigenous rural values. Limited resources and access to quality care. Geographical isolation can compel the provider to make decisions based on location rather than using up-to-date technology and knowledge. The patient's inability to pay for care. Rural providers often have to decide whether or not to provide necessary care with little to no reimbursement for the treatment that was provided. Referral to specialized or distant medical centers. Patients may resist or refuse care in an environment that they are unfamiliar with. As a result, the provider is put in a position to provide suboptimal care, or they may feel uncomfortable providing care because that's not their specialty. Allocation of resources. This is a growing conflict that is noted by rural physicians, nurses, case managers, and other administrators. So time and treatment must be routinely allocated, and the poorer the community is, the sicker the individuals can be, and the fewer resources that are available to provide treatment to the individuals within the community. So there are 9 provisions under the ANA Code of Ethics for Nurses. I'm not going to name all of these because I don't have time in the video, but I'll leave the slide up so you can review these. There's also Code of Ethics for physicians, all different healthcare professions. So it is good to look it up and know your code of ethics for your profession. So it's important to uphold ethical principles when dealing with patient care technologies in the community setting. New age technology challenges ethical principles. It's important to balance the human element with technology. Patient-centered care comes before the technology. Patients have rights, and these rights should not be ignored. And respect the patient's choice. Balance technology cost and benefit to the community. See if one outweighs the other. Successfully adopting and integrating new technologies requires healthcare providers to understand the benefits as well as its limitations. That's very important. There are limitations. There's always limitations. Support the patient in being more active in their healthcare. However, little research has been done to validate information on the internet, so ensure that the sources that the patient is using are credible sources. Inform the patient that there are many websites that collect user data without their permission. That is unethical and it's a violation of their rights. Technology should be used to supplement human resources, not eliminate them. So here's a rural healthcare ethics agenda that proposes developing a better understanding of the concepts and capacity of rural healthcare ethics. Increase the knowledge and understanding of issues on rural healthcare ethics as it is perceived by the rural community and healthcare professionals. Increase knowledge and understanding of rural healthcare ethics decision-making. Work in partnership with rural healthcare professionals to outline guidelines for dealing with common ethical conflicts that occur in the community. Survey, assess, and suggest models for practicing ethics in small rural health facilities. Develop and employ ethics training curriculums and other educational resources for and with rural clinicians, administrators, and policymakers. Provide an ethics assessment to administrators and policymakers who are in charge of allocating healthcare resources. Promote a discussion with healthcare providers within the community regarding the specific nature of rural ethical issues. Here are the answers to the pretest. Let's see how you did. Question 1. Ethics is a system of moral principles and values that affect how people make decisions or judgments. Answer is A. True. Question 2. From a moral standpoint, ethics can vary depending on the following. The answers are A and C. Values and culture. Question 3. The process of making an ethical decision begins with which of the following? The answer is B. Stop and think. Question 4. There are blank steps of the ethics and compliance risk management process. The answer is C. 5. Question 5. Ethical dilemmas are situations in which a difficult choice has to be made between two courses of action. The answer is A. True. Question 6. Examples of ethical dilemmas in rural communities include. The answer is H. All of the above. Question 7. The poorer the community is, the sicker individuals can be, and fewer resources are available to provide treatment. The answer is A. True. Question 8. There are blank provisions in the ANA Code of Ethics for Nurses. The answer is D. 9 provisions. Question 9. Successfully blank and blank new technologies require healthcare providers to understand the benefits as well as its limitations. The answers are B. Adopting and integrating. Question 10. The Rural Healthcare Ethics Agenda includes surveying, assessing, and suggesting models for practicing ethics in small rural health facilities. The answer is A. True. Here are some additional resources.